we're told things like, oh, your hormones are just made to make you crazy. When in reality, this could be signs that you're neurodivergent. So you could be autistic or have ADHD. It could be PMDD. And a lot of times what we see in our culture is that these symptoms are much, much worse as we get into perimenopause. And rather than anybody saying, I mean, this is where it's so problematic to be like, hormone imbalances are not real. There's nothing you can do about it, because it's like, but you acknowledge that these symptoms are because of our hormones. But because that is such the mantra that is parroted without anybody stopping to really like put a little thought into it, this demographic is the highest prescribed and receivers of prescriptions of mood altering drugs, so antidepressants and anti-anxiety medication. And I'm like, wow, but like those things don't necessarily protect your brain health, your bone health, your heart health, your myelin sheath of your brain, like all of these things in the way that bioidentical progesterone could, or even, you know, estradiol, once you get into that phase where you're not producing enough estrogen. But instead, because again, if it's a women specific issue, we lack the research, we lack the understanding, we lack the, you know, just given an F, honestly, in medicine. It's like, we'll just medicate them away, which is really a throwback to the time where like we were medicating moms with like Valium in the 1950s, and like, you know, putting women, you know, under twilight anesthesia so that like we could just extract babies from them. It's this entire thing of like, let's just get the woman out of the way and like just, you know, hush her